The last time you were here, Mrs. Nadler, we did the ECG because you felt like your heart was pounding and you also felt weak and dizzy. We discovered that you were in atrial fibrillation. So how are you feeling lately?
Mostly okay. But every couple of days I get these episodes where it feels like my heart is beating really fast, skipping beats, and I'm worried about it.
Yeah, I can understand that. Atrial fibrillation can cause episodes like that. As you can see, what's happening is that the upper two chambers of your heart, the atria, are quivering or fibrillating instead of beating normally. I wanted to see you today so we could talk about how atrial fibrillation increases your risk of stroke and go over some of the ways we can reduce that risk.
Okay.
In patients with atrial fibrillation, the heart beats more quickly and irregularly than it should. This can allow blood to pool in the heart chambers, which in turn can cause blood clots to form. If clots leave the heart and move through the body, they can travel to the brain and cause a stroke. However, not everyone with atrial fibrillation has the same risk. I've calculated your stroke risk with a tool called the CHADS-2 score, which looks at several factors: congestive heart failure, blood pressure, age, diabetes, and previous stroke. Your score of 3 suggests that you have about a 6% chance of experiencing a stroke within the next year.
Oh my.
Because of this score, I'd like to put you on an anticoagulant, which is a blood thinning medication.
Will taking a blood thinner keep me from having a stroke?
Well, no, the risk of stroke can't be completely eliminated. But that being said, anticoagulants have been shown to reduce the risk of stroke in patients with your condition. Anticoagulants decrease the chance that a clot will form in your blood.
Isn't aspirin a blood thinner? Couldn't I just take that?
Yeah, you're right. Aspirin is a blood thinner, and some patients do use aspirin for this purpose. However, in your case, because your CHADS-2 score suggests that you are at a higher risk of stroke, you should consider either warfarin or one of the newer anticoagulants.
What is warfarin?
Warfarin is the most commonly used anticoagulant, also known as Coumadin. Warfarin works with your liver to keep these clotting factors from being made. If you choose to go with warfarin, we'll have to test your blood on a regular basis, at least weekly to start, just to make sure that you're getting the proper dose. We'll use a blood test that's called an INR, which stands for International Normalized Ratio. It basically measures how long it takes your blood to clot. We want this number to fall within a specific range, usually between 2.0 and 3.0.
I see.
And we'll adjust your warfarin dosage as needed to get you to stay within that range. Now, there are some concerns with warfarin that we should discuss. First, it interacts with many commonly used drugs, so you'll need to keep me and your other doctors in the loop about the medications you're taking. Also, warfarin has some food interactions as well. For example, you'll need to be careful with foods that have a high amount of vitamin K, such as leafy greens. Don't worry, I'll give you a handout that explains all these interactions in more detail.
Yes, that'd be helpful. You also mentioned newer medications. Do those require testing as well?
The newer blood thinners have pluses and minuses. Dabigatran and rivaroxaban are excellent alternatives. They don't require the regular INR testing, and they have fewer food and drug interactions. We would, however, need to check your kidney function before putting you on either of these medications. A key disadvantage to using dabigatran or rivaroxaban pertains to bleeding risk. Because all anticoagulants thin your blood, your body can have trouble forming clots to stop bleeding when necessary. Warfarin's blood thinning effects can be reversed with vitamin K and blood plasma. However, these newer agents' effects can't be easily reversed. It's important to know that any anticoagulant will increase the risk of bleeding, so you'll need to avoid potentially dangerous situations. You may also bruise more easily, and should call me right away if you bruise excessively or notice any blood in your stool or urine.
Okay. How often do I need to see you after I start taking the medication?
Well, that depends. If we decide you should try warfarin, we'll set you up for your tests right away. The first one should be a few days after you start therapy, and then we would have to retest weekly until the number is stable. After that, your INR would be tested about once a month. Regardless of the agent we select, I'll want to see you again next week to see how you're doing with the medication.
How long will I need to be on this blood thinner?
Well, unfortunately, you should stay on anticoagulant therapy as long as you have atrial fibrillation, or as long as we believe you can still have episodes. Most patients with atrial fibrillation who are taking anticoagulants need to stay on them indefinitely. I also want to mention that it's very important that you take your medications every day, according to the package instructions. Even missing just one single day of medication can increase your risk of stroke. But I'm here to help you with any questions or concerns you may have along the way.
I appreciate it. I guess I'll make an appointment to see you next week.
Great. We'll see you then.